hopefully.
Okay, okay. That's great. Do we have any apologies intimated, Elaine?
I have apologies from Councillor Airlie Nicholson, and Councillor Michelle Campbell is her substitute. She's attending the meeting, and I have apologies from Annie here.
Okay, that's great, thanks. Do we have any declarations of interest or transparency statements? No, hang on. Is there any hands up there? No? Hang on.
Michelle and
Ian.
Okay. Michelle?
Thank you, Chair. I am just declaring a connection across the papers because I work for HSGG&C, but not within this HSCP area, so I'll be participating in all items. Thank you.
Okay, that's great. Thanks, Michelle. And Ian?
Hi there. In page 75, there's mention of St Vincent's Hospice. I'm an ambassador for St Vincent's Hospice, but I don't think it stops me from taking part in any discussion. Thank you.
Okay, that's great. Thanks, Ian. All right, if we just move on to the items of business, the first thing is the minutes of the last meeting. So it's from page 5 to 12. Do we have any questions or comments around the corrections around the minutes? So we're all in agreement, the minutes are accurate. Okay, that takes us to item 2, which is the IJB Action Log. Wait a second to find the page. So the first item is the NHS GGC Mental Health Strategy Renfrewshire Implementation Update. So the status is the report will be submitted when the information is available to NHS GGC. The second item is Unscheduled Care Winter Update, an update from the NHS GGC scheduled to come forward in January. So that's fine. Next item is the Chair and the Vice Chair of the IJB Audit and Scrutiny Committee report relative to the appointments of chairs and vice chairs for a 2-year period. The report will be submitted following the review of the integrational scheme. So I don't know if anyone wants to speak at all on anything like that.
Not in particular. There are Mark had indicated to me that there are a couple of items against his name in the action log which are going to be taken forward once there are other questions round about governance more generally that he's thinking about and possibly we'll be having some discussion about. But that's all. That's the only reason that these are. I've not got anything in particular marked against them for the time being.
That's fine then. The next thing is the arrangements for future meetings. Now, we've spoken about this at the IJB quite a few times, because obviously we have mixed opinions of whether meeting in person or staying with a hybrid model. But what we did agree was we would keep it online for transparency, because obviously we're going into a period now where we are having to make difficult decisions. And what we didn't want to be seen to be doing was taking away the access of anybody being able to join online and taking it back into behind closed doors. So that was our methodology, plus the fact that we don't have a hybrid computer system that was going to be suitable for us to allow people to still work from home. You've always got to have that option now, you know, that, you know, people can still be able to phone in, and we didn't have that kind of setup that was going to work for the IJB. But I do realise that we were trying to procure equipment for ourselves, and hopefully going into the new year, we'll see where we're at with that. Ian McMillan, I see your hands up.
I just feel as if I've got to be consistent in this one. There is a council chamber in Paisley that's probably lying empty right now, which I think would be put to good use for meetings of the IJB. And I know that when we started the IJB, that it was always felt that we should be meeting in neutral ground. And for quite a number of meetings, we met up in the Abercorn suite up in the West College, which was ideal, which was fine, and I didn't have a problem with that. But I think, you know, it's a shame that council building is sitting there. And I don't think it makes any difference whether you're in an NHS or whether you're in a council or where you're meeting, I don't know, in a library or something. I don't think it makes any difference as long as it meets all the needs of the technology. And the council chambers in Paisley meets them. There's car parking, and probably more importantly, any public who want to come in can come in and listen to what's been said. So I'm once again punting the idea of using Renfrewshire House. Thanks.
Thanks, Ian. Anne, Cameron Burns.
Thanks, Jennifer. I have to agree with Ian. I don't know why we don't use it. I don't know why we need neutral ground. I don't see this being NHS and council. I see it as being the HSCP. So I would agree with Ian. Why are we not using that building? If there was enough in the boardroom, if we could get the boardroom, but it's always getting booked to, I would say use the boardroom. But I agree with Ian. I think we need to use the buildings that are available, that have the technology. We use the council building down in Clyde for our IJB, because they have the technology there to have it in person, and there's no that territorial issues that seem to be. I don't know what it is up here. I don't know.
Well, why don't we put it in the agenda for the next development day, and we can all get our voice, how we feel about it there. I mean, I agree with you to an extent. I think the feeling was surrounding how formal the chamber is, because the IJB, was quite informal. We could all sit around the table, as in the actual kind of chamber itself set out very much like a kind of court of law, the way that, you sit in your chair and then the rest of them are sitting around, So I think that was the original thinking of why not to go into the chamber. But I'm actually all right with the idea of going back in person. So, let's put it on the agenda for the next development day, and we can take a wee ballot and see where how we all feel about. Because I know John Matthews is very keen as well to get back in person, aren't you, John? So let's put it on the agenda for the next development day, and we can take a poll and see how we want to proceed going forward. Okay, do we agree with that? All righty. So then the next item on the rolling action log is the financial report. So an update will be provided when available. Any questions around that? 2 more items. Oh, Ian, come on in.
I know this is a very, very difficult question to answer, but have we any idea when we're likely to get word from the council? I know the Scottish budget's not until kind of mid-December, and obviously we have a Christmas and New Year break. So I'm not entirely sure how quickly we can get that information, but given what we'll be discussing in the next 10-15 minutes or so, I think it's important we get this information as quickly as possible.
Yep, I think so too, Ian. I wrote to Alice MacArthur for some reassurance, and he sent me a response. I'll just bring Sarah in and she can explain it in a bit more detail.
So this particular action was in relation to the pass-through of any allocation of funding for staffing costs, and the Director of Finance for the Council has confirmed in writing that they will pass through any available funding that we get from the Scottish Government. However, that won't be enough to meet, it is unlikely that that will be enough to meet the costs of the pay award. So it's likely that the actual IJB will have to fund any shortfall. What that is at the moment, I'm not clear, because we still haven't got full agreement of the pay award and the impact of that. But Alistair has confirmed that they will pass through, the council will pass through our proportionate share. So he has confirmed that. In terms of the rest of the budget, it's unlikely we'll know what that's going to be until mid-January or February, because it's the 19th of December that the Scottish Government budget will be announced, and by the time that's gone through the various different iterations and backwards and forwards between councils, COSA, etc., it's usually quite late on January, February that we will find out exactly how much we will be passed through. So that's an update for the staffing, which was the action in that log. So hopefully that covers that off.
And I can send you a copy of the email I got from Alistair just confirming that, Ian, okay? I'll do that. Okay, so the next, no worries. The next item is Renfrewshire's Alcohol and Drug Partnership Annual Reporting Survey. So that report will be provided when details are available. And the last item on it is the performance scorecard, and updated provided in the Chief Officer's report will be considered at this meeting. So there we go. Right, so that's a rolling action log. So we're all okay with that? All right, so we'll move on to item 3, which is the Chief Officer's report. Now, given what we've got on the agenda today, and to try and allow as much time as possible so we can have discussions around it, I've just asked Christine to maybe pick out 1 or 2 things and really just open up for questions if anybody's got any questions. And so key updates, national policy and whatnot. So if there's any questions, please put your hand up. But Christine, if you maybe just want to.
So members, thanks very much, Jennifer. Members will be very familiar with this format, and as Jennifer said, it's really an update on specific things in relation to Renfrewshire, but also some wider national policy. The only thing I really want to draw people's attention to, because we've had quite a bit of discussion around CAMS of late, and a discussion in my colleagues from Eastern Bartonshire, HSCP also attended a previous IJB to explain the board's decision to for Eastern Bartonshire to take over the hosting arrangements of our CAMS service. So although we still have CAMS services locally within Renfrewshire, we don't have the overall management of that, but I know that we agreed that it would be helpful, members would feel that it would be helpful to get just an update on where we are in terms of performance. So at item 6, you will see that we are in a very good position within Renfrewshire, that at the beginning of November, our performance was showing that 100% of our children and young people were being seen within we're waiting for less than the target of 18 weeks. So that's a significant shift from, I think, last year, we were just over around the 53, just over 50% mark. So that the team have done a lot of work on that to get us to the position that we're in. And you'll see that there is the longest wait in relation to date, for an appointment in Renfrewshire CAMS is 9 weeks. So we are working hard to maintain that. The target is 90% and we're sitting at 100. Across GG&C, the performance is at 98%. So it was just to highlight that. There's a number of other updates, but just conscious that we want to reserve as much time as possible to talk about sustainable futures later on the agenda, but happy to answer any questions.
I was pleased to see that, Christine. I think it is important that we don't lose oversight of it, and especially when it's doing so well. It's a really good thing to see, because for long and weary, we were really always concerned. It was an item that was always raised with great concern in the IJB because of the waiting times people were subjected to. So it's a real positive step to see those kind of figures now. Ian McMillan, I see your hands up.
Aye, just a couple of points. Yeah, good progress on the CAMS. It's long been an issue for us. The turnaround is quite remarkable, and I don't mean to sound cynical, but can you tell me exactly when it says commence treatment, what stage in their journey through CAMS is that? What do we actually mean by commence? Does it mean they've just got a letter to come along, or does it mean they've actually started seeing people and discussing their issues with them? So if you can maybe clarify that. The other thing I wanted to raise was in 17.1. It was the Audit Scotland report on adult mental health. Quite damning of the Scottish Government in this report. So how concerning is that when our government doesn't seem to have a handle on the issue of mental health? And also, and it's not for me to tell you, Christine, what to put in your report, but at some point, can we have some kind of rundown on how respite services are going in Renfrewshire? I sometimes think respite is a poor relation of care services. I'm not saying it is, but sometimes it doesn't seem to get an awful lot of mention. So I would like to see something, even if it was not on the board itself. If you could just give me a wee update on how we're getting on with respite services in Renfrewshire, that would be appreciated. Thank you.
Yeah.
Thank you very much, Ian. So I'll go backwards. So the respite, we can absolutely update on respite at a future meeting. We can maybe do a bit of a deeper dive around that, of what we have got in place in Renfrewshire, and what we are the direction of travel around that. Mental health strategy, you'll see on the agenda that Laura, our head of service, is going to be talking about the refresh of the NHS GG&C strategy. So the item 17 is about the national strategy. So hopefully you will see the work that we are doing within GG&C and within Renfrewshire, and that might give you some assurance. The first point on CAMS is, so the Scottish Government target is from referral to treatment, and that's to be your children, young people to be seen within 18 weeks. So that's the target that we're measuring. There's other things that in terms of, and I know we've discussed this before, around if young people or children are then deemed from that appointment and that assessment as maybe requiring a different type of assessment around ADHD or autism, that is something that we are working on, and that's a national challenge, not just a Renfrewshire challenge, because it's such a complex assessment and requires a number of clinicians at the same time to work with the family and with the school. So what I've reported on is the target that is measured from Scottish Government.
Okay,
Okay,
quite
thank you.
happy. All right.
Yeah, thank you.
Margaret Kerr.
Thanks, Jennifer. Christine, thanks for that. Can I just expand slightly on the CAMS piece with you? And it was just to understand that obviously that's been a good improvement. That's great to see. And I know you can't predict the future, but is your sense that the service is now sustainable? Because that's the primary objective of the changes that were made. So are we getting that confidence that that level of performance can continue because of the restructuring that was done to try and make that a more consistently positive service there?
Certainly. So our performance had increased and was over the target prior to transfer over to East Dun. And as you say, Margaret, one of our main aims is to making sure that we can sustain that. So we had a number of issues in the past. A lot of it was around recruitment and retention of staff. And again, that's not a Renfrewshire or a GGC issue only. It's a national issue around being able to attract psychiatrists and psychologists in the main into the service. We also did a number of pieces of action. You'll remember that Jackie Dougal, she updated on us on some of the action, and that was around looking at how best. We were really concerned, if you remember, about the level of DNA, so the number of families not attending for appointment, and we had a look at that to see if there was a more efficient and better way to manage that, and that was around, rather than us, quite a simple thing, writing out to families just allocating an appointment. We allocated an appointment, but then phoned the family in advance to say, does this appointment suit? For all, a host of reasons, families might say, that doesn't suit, I've got young kids, I need to take them to school early in the morning, or a work or whatever. So we then work to offer appointments in a much more flexible basis, and that is absolutely reduced in our DNA, which improves our performance and the use of our resources. So we do believe that there's been a number of changes in how we deliver that service that is much more sustainable now, and we think that the decision by the board to centralise the management also gives a level of resilience, because it means that if there's a particular area that has got challenges around staffing or whatever, that some resource can potentially be pulled to address that. So we're confident, having spoken very recently, actually last week, to our service manager who's based in Renfrewshire, we're confident that actually the changes we've made have made the service more sustainable.
Super, thanks, Christine. That's incredibly helpful.
Thank you. Okay, so we all agree to note Christine's report. Okay, that moves us on to item 4, which is the Chief Finance Officer, which is yourself, Sarah.
Good morning. So the finance report is pretty much in line with everything we've reported to date. However, there's a couple of things I want to draw the IJB's attention to today. And first of all is to note the in-year position and the projected year-end position, and also to approve the repurposing of the reserve highlighted in section 8.8 of this report. But also I wanted to discuss with the IJB the current position of prescribing, which is reported as an overspend, projected year-end overspend of 2 million at the moment. But unfortunately, the latest data is showing that that has significantly moved. And I have a couple of slides that I would probably best explain this. If you are happy for me to share them with the IJB, we can put them up just to give a bit of context and to explain. But I thought it was really important that members are aware that prescribing has shifted yet again.
Yeah.
So James, would you mind popping them up, and I'll just I won't spend too long on it. And just to remind everyone that we did have the detailed discussion on prescribing at the development session, where Audrey Thompson came to discuss the ongoing pressures within prescribing. So you'll see the current position in the finance report reflects the £2 million overspend. However, since the report was done, which was at the end of September, and obviously it's all to do with the timing when the papers come in to the IJB, that position has now moved to about 3.1 million, which is a significant movement. However, that's still heavily caveated because the data that we're using is still being verified within the Scottish Government within NSS. So that is still absolutely heavily caveated. It could move yet again. However, if we see on the next slide, James, if you don't mind, which you can see from this, it actually shows how the expenditure is differing from previous years. It's quite difficult to see it in the colours, I'm sorry about that, but the purple line shows exactly how the expenditure is going up each month. So you've gone from the start of this year, where it was roughly just under 3.3 million, where we've had peaks and troughs right up to 3.7, and then almost 3.9 million towards the year end. So you can see there are loads of peaks and troughs, and it's very difficult to determine exactly how that's going to go through the next few financial periods. And then if you could go, James, to slide 4, hopefully this will explain more clearly and more simply why this is happening. So at the start of the year, we had unit costs of about £10.70. That then moved to about £11.32 in October 23, and we think it's going to be up to £11.46 from November to the year end. And that reflects supply and demand in the market, and that's having a huge impact on the cost of drugs at the moment. So what I'm saying here is a 1% increase in price is about 182,000 of an impact for us. And the same for volume. Any increases in volume, that costs us about 177,000 for a 1% increase. And the chart below shows how volumes have moved throughout this financial year to date, bearing in mind that, again, this data is still heavily caveated, but I'm trying to make sure that there are no surprises. So the final slide is just me showing a few of the comparison of movement in drugs in terms of the average cost and also the volumes that are being prescribed at the moment. So that it's really important that we can see that actually a small change can have a massive effect, but also some of these drugs have gone up hugely, like 81%. I can't pronounce some of these, so I'm not going to try to, but I did try yesterday, but I failed miserably. So you can see the percentage of increase in some of these drugs, 81%, 95%, and the same again with the volume, they're hugely increasing. And that reflects the acuity of the public at the moment and the need for some of these prescriptions to be made. And obviously GPs are very pragmatic and careful when they're prescribing, so it isn't reflective of anything that they're doing. It's just this is where we are as a society at the moment. But you'll be aware that we have the cost avoidance programme in place, and we were doing every single thing we can to try and mitigate this, but there is a limit to what we can do. So I just wanted to bring that to the IJB's attention today, and hopefully that's been quite clear to show you what that impact is having on our budget. So I won't go through any more detail on prescribing just now, but I would add that as part of the work that my team is doing at the moment, and recognising the impact on the bottom line. We're reviewing all of our earmarked reserves to try and maximise their use, and we will be drawing down more earmarked reserves throughout the financial year to try and protect the general reserves as much as possible, so that we have some monies going forward to protect us into the future. So I'll end there, but happy to take any questions, and apologies for more bad news. It is a really difficult time that we're in at the moment, and at the moment I can't see that that will improve.
Thank you, Sarah. You always do a really good job of breaking everything down for us, you know, and this prescribing, I mean, the cost of prescribing, and the fact there's not a overarching regulatory body there to regulate it, you know, and the cost can increase so much is just something I struggle to get my head around at times. The 8.8 repurposing the reserves here, the bereavement network, Sarah, that's part of your report. Hang on a second for this. Yeah.
Yes, shall I bring Frances in for that one, and she can just put a bit of background on it? Frances?
Yeah, no problem. This relates to some money that we had put aside for a post relating to compassionate Renfrewshire. But in the current climate, we felt that rather than trying to set up something new on a temporary basis, as it's not recurring money, and the challenges of recruiting to a fixed term post, that this funding would be better used to continuing a service that we already provide and that has is proven vital to our community. So the bereavement network, which many of you will be aware of and we've highlighted in our annual performance report, was established during the pandemic, and it's consistently evaluated well and demonstrated a real ongoing need for this. So we felt, given the budget challenges, it was important to just retain this rather than starting something new and untested. So, and the bereavement network also aligns with Renfrewshire's palliative care strategy, as bereavement support is one of our key priorities. So, I mean, it's still allowing the money to contribute towards compassionate Renfrewshire, just through existing work. So I don't know if that's
no,
enough,
that does
or...
it. No, I'm pleased. I was pleased to see it. That's fine. I see there's a few hands up here, so I'll go to Stuart. Stuart's in.
Thank you. It's a really brief point about prescribing, but I think that the point is made on the volume chart that Sarah showed. Most of those are heart failure or diabetes medications, and they're the more modern and newer heart failure and diabetes medications, all of which are evidence-based, and all of which probably we're using more of because it's the right thing to do to maximally manage people's chronic disease, to prevent illness downstream. So you're thinking about kidney damage, hypertension, you're thinking about foot problems, as Paul and the team would deal with in terms of diabetes. So I think, unfortunately, some of this spend is really important, and it will have a positive impact, in terms of morbidity down the line, but ultimately is increasing in volume and expense. But as Sarah said, we're doing everything we can, and we're working really closely with GPs. We're looking at individual practice spend at individual kind of groups of drugs to try and make sure that everything that is being prescribed is an evidence-based and necessary treatment, and wherever drugs are kind of not necessary, or we feel people could stop them safely and appropriately, which is a key plank of the realistic medicine agenda from the Chief Medical Officer, that we would be doing that. But I think it just illustrates the type of drugs that you're looking at there, which are the modern heart failure and diabetes drugs that didn't exist when I qualified, for example.
I think that's really important, sure, to get that kind of context. Absolutely, prevention is better than cure. I'm behind you 100%, but that's really helpful, Stuart. Thank you. Francis.
Sorry, yeah, I just wanted to ask, in terms of the cost of prescribing, is that simply the cost of the drug? Does that include the whole process of going through, the process of getting a prescription, taking it to be filled, and so forth? I was curious about the cost of paracetamol, for example, being included, and is it possible to get some people off prescribed drugs like that onto just getting them from the supermarket, where they're quite cheap?
I don't mind.
Pass to Stuart for that one.
So I think that there is obviously the pharmacy first approach, which we've talked about before, which would encourage people to to use the pharmacy wherever possible. And obviously it is funded for people to use that service if they're eligible to get paracetamol and minor ailments treatments for free as part of an NHS service. So so that is another route. And obviously if people can afford it and wish to do so, they would be buying things themselves over the counter. But I think it is a challenging situation, particularly where people are on large volumes of these medications regularly. You know, if you're using eight paracetamol a day as a maximum dose every day, to say to someone go and buy 16 from the supermarket every couple of days is not, you know, is not practical. So I think obviously we do signpost people and wherever possible that would be the case, but I think it becomes increasingly challenging with the general cost of living people are facing generally, particularly for children as well.
Okay, thanks for that. And sorry, Ian McMillan, I see your hand was actually up first. I must have missed that, Ian, sorry.
No, it's all right, absolutely fine. A number of the questions I was going to ask have just been answered. I had big concerns about the paracetamol. You know, when you walk into your supermarket and you're paying literally pennies, but I get what Stuart's saying. You know, it's, would people go to the supermarket every 2 or 3 days? I'm not entirely sure if that would happen. Maybe it's something we could maybe educate people on. I was on to ask a question about the money for a court hospice, but that's been answered as well. And I think as well the wage settlement as well, as was Sarah had mentioned right at the very beginning of the meeting, I think that's a concern. I'm certainly not against workers getting decent pay, of course not, but there is a knock-on effect for the services that we provide here in Renfrewshire. So just put a red flag up for that one as a real warning. You know, and we had an announcement down in London earlier in the week about the increase in the minimum wage, which I would certainly welcome. In fact, I don't think it goes far enough in terms of the minimum wage, but again, it still has ramifications for us here at trying to provide care services. Thanks.
Thanks, Ian. Michelle Campbell.
Thank you, Chair. So it was just a general point that I wanted to make, if that's okay, which is that I get the point about price and cost, but there's also a cost to society. Things such as, see, our pharmacies, when people go and pick up the prescriptions, part of that is about a welfare check as well. There's an opportunity for referral into other services if there's concerns. So it's about that wraparound care that allows for that, and that in itself is it helps for us as a general society to have that accountability of assisting people that might not recognise their needs. And I think that we have to pay recognisance to the way that we have modernised services, the way that we do wraparound care. It's so important. I have always advocated that I think that there's a need for full reform of our procurement processes and of clinical governance being a lead point in NHS care. I don't believe that clinical governance is as effective as it was intended to be. And I'm hoping that the Scottish Government will take action, and the UK Government in NHS care, that they go for full reform and don't just put another plaster over an issue that needs to be addressed, and it needs to have clinicians at the forefront of those decisions that have to be made. Thank you.
Thank you for that, Michelle. Okay, so, there's a hand. 2 seconds to find out who it is. It's disappeared. So nobody else on ask any questions on Sarah's. So we can agree to note the in-year position of the 30th of September, note the projected year-end position 23-24, and approve the proposed repurposing of the reserves in item 8.8, which is the accord hospice item. So are we in agreement with that? All agreed? Yes. Okay. Well, that takes us on to the next item, which I'm sure is sustainable futures. Somebody will correct me if I'm wrong, but I think that's what I'm at. Okay. So, Frances,
that's me. Thanks, Chair. Okay, today we present a further update to our Sustainable Futures programme on the work that we've undertaken since the last meeting in September to identify saving options to address the IJB's financial gap, and also to ensure that we can meet our legal requirement to deliver a balanced budget at the end of March 24. As you'll be aware, the gap is currently projected at 14.7 million. However, I'm sure members will appreciate from today's update from Sarah on the financial position and prescribing that this will be subject to change. So the paper presents a range of proposals which, if realised, would deliver around 3.3 million of recurring savings to our budget. We've always recognised that the 14.7 million budget gap will be exceptionally challenging to bridge, and I appreciate today that the savings we're presenting are more limited than we had envisaged. This is principally due to a number of risks that we identified early on becoming issues, and this is just as a result of a number of changes in the IJB's operating context, which influenced the scale of the savings that we are able to deliver. And you can find, I won't go through the detail of that, but they are outlined in section 5 of the report. So whilst this isn't the position that we wanted to be in, I would say it is consistent with what we're seeing across a number of other HSCPs nationally who are challenged by a deteriorating financial position. Also reflecting on this position, in addition to the specific savings that we will be asking the IJB to consider today, we are also asking you to approve a refined approach to address the budget gap, recognising that we will need to do this in both a recurring and non-recurring way. And whilst this approach has been refined, I think it's really important to note that it continues to reflect the projects and the sort of areas that the IJB have previously considered and agreed to form part of the scope of the Sustainable Futures programme. So it's not adding any new areas in. I'll just touch on the approach. It's set out in section 6 of the paper, but maybe more helpfully, the visual representation in Appendix 1, which clearly shows 5 elements to our approach. The first element, if I go from left to right, relates to the specific proposals that we're going to ask the IJB to consider today, and I'll come on to them in a bit more detail. The second element is our commitment to come back to the IJB in our January and March meetings, so before the end of this financial year, with further savings. And we're proposing that these will be in relation to charging, which we have noted is subject to council approval, eligibility and self-directed support, community meals, and also looking at wider savings in relation to our soft FM. So that's things like cleaning, so facilities management. The third element in our approach notes the critical cost avoidance work that we're doing to robustly manage our overspends, and the IJB from the papers that Sarah's presented previously will be familiar with them, namely care at home, mental health, enhanced observations, prescribing, which we've just talked about. And we're also planning going forward to take a risk assessed approach to holding vacancies where possible. The fourth element, as I've mentioned, recognises that we will not be in a position to address our budget gap on a recurring basis at the end of March 2024. So it sets how we plan to use reserves and also the pension rebate to deliver financial balance. The final element in the approach that we discussed recognises that whilst we will be using non-recurring actions to deliver that financial balance, we do need to deliver financial sustainability and address that gap on a recurring basis. So it therefore seeks approval to carry out some wider reviews into 24-25. And there's detail in the report, but these relate to residential respite, extra care housing, and our day support models. So picking up now on the specific savings in the report today, these are in the range of circa 3.3 million. I don't plan to go into each of these savings in depth, as members will be familiar with the detail and the rationale for these from our development sessions that we've held. However, our heads of service and chief officer are available to answer any further questions that you might have at the end. So I'll just quickly touch on each of the proposals and what the ask today is of the IJB members. So the first proposal relates to the health payroll budget, and there are two asks there. First, that the members note the financial savings relating to the review of the health payroll methodology. So you're not being asked to approve that, but just note the work that's been done. However, members are asked to approve that staff turnover of 4% is built into the annual budget setting cycle, which our financial team believe is a reasonable figure to build in. The second saving relates to contract management efficiencies that are identified through our business as usual ongoing review of contracts. So the IJB are really just asked to note this and how these savings will contribute to assisting us address the financial gap. Then there are a number of proposals today where we're actually seeking the IJB's approval, not to proceed immediately with these, but rather to carry out a full options appraisal and impact assessment, and that would include stakeholder engagement. So the options that we're asking for this approval for relates to, firstly, the reduction in our HSCP internal care home estate from 3 to 2. And this is in light of a changing demand and need that we're seeing. And at this stage, no specific care home has been identified. The next few proposals relate to our day services. The first is to look at merging the Mirren and Milldale learning disability day services to develop a more community-based outreach model, but would still retain a building base. Also, to close our FlexiCare. This is an informal, non-statutory service for young people and adults with learning disability or autism to take part in social and recreational activities. We're also asking to reduce the staffing at the Disability Resource Centre by 2 FTEs, in line with the occupancy rates, where we've seen an average of 80% occupancy over the last 12 months. We're also looking to confirm the permanent closure of our Falcon Day Centre for older people and the maintenance of the current closure at the Montrose Day Centre pending the outcome of the residential care proposal. And then the final proposal is to ensure equity across all our services. It's proposed that the critical and substantial eligibility are fully applied to community meals and community alarm service. And this proposal was actually agreed by the IJB back in 2020, but paused as a result of the pandemic. So we thought it was important to bring that back for visibility to the IJB and not get approval for our intention to now look to implement that. So before I pass over for questions, I just wanted to highlight that we recognise that in light of the challenging position and legal requirement to deliver a balanced budget, that the IJB have been asked to make difficult decisions today and are going to be asked of more in the coming months. Developing our approach and the proposals that we present today has been exceptionally difficult for us as an SMT, as we are really fully committed to delivering the best health and wellbeing outcomes for the people of Renfrewshire. However, given the current position that we're in, we feel we are doing the best we can to manage increasing demand, acuity of need, as we've discussed already in this meeting, and maintaining the high performance as far as possible. So I must emphasise that even if we realise these savings in future, this won't deliver on the full gap. So this is only the beginning of a really difficult journey for the IJB and for everybody. So the only final point just to make is that if members agree for us to further develop these savings, it's our commitment to begin a period of engagement with our service users, residents, family and carers, as well as the HSCP staff that work in these services. And this will allow us to gain a fuller understanding of their views on the options, and we will use that to shape and inform the proposals that we bring back to the IJB. So happy to take questions. Either I'll answer them myself or I'll pass over to my colleagues. Thanks.
Thank you for that, Frances. I realise it's very challenging. Can I just clarify a few things here? And I know that we've discussed it, but I just want, obviously, the members that haven't attended development days and whatnot. So we've got, see, the proposal to combine Mirren and Milldale. Now, what we're saying there as well is that the building that will inevitably end up in will actually will be chosen as a result of the engagement process that we go into. Is that right? So you go into an engagement process and the merger. So the building that they decide will be decided by the service users. Is that right, Frances? I think it would have been helpful if that had been in the paper just for clarity. But am I correct in thinking that? Yeah.
I'll pass over. Sorry.
Thanks, Frances. Thanks, Chair. We'll need to discuss that, and there'll be a range of different factors in relation to whatever building base is deemed to be the most appropriate. So people's views on that absolutely will be considered, along with accessibility to a range of community options, Jennifer, as well as where people currently are. So within Renfrewshire, we've got a number of people who attend services that are out with what would be deemed as their catchment area in relation to transport. So a range of different considerations and factors will need to be looked at in determining, through that process, if the option is taken forward to do that.
Right, okay. And my other thing I was going to ask somebody to one of the officers to speak on is the community meals, because again, it's been explained to us, but for anybody joining, just to explain the fact that, well, what we were told was that when you're just getting discharged from hospital, that it can be asked at the time, do you need a community meal? And if somebody says yes, then they've got this community meal, but that person actually doesn't attend any of our other services. So that would lead us to think that it's not going out to the most vulnerable, and it's heavily subsidised. So if I could just get an officer just tell everybody more information around that would be helpful.
Yeah, thanks, Chair. I can pick that up. So you're absolutely right in terms of community meal provision. There's a number of referral sources. Some of it can be people can self-refer for community meals, but like you just described, if someone's in hospital, for example, and perhaps has a broken arm, and some of the support that they're given on discharge could be the provision of a community meal. At the moment, that's not subject to any eligibility criteria. And I suppose what the ask of the IJB is that this was already a proposal that was taken to the IJB in January 2020, but obviously with the introduction of COVID, we didn't progress that at the time, and it's really just to go back and revisit that so that we have equity of services. At the moment, we have 220 people who don't get any other services but get community meals. However, what we would be doing would be applying it to any new services, and then when we're going back to review our existing packages support, we would apply the eligibility criteria like we would with any other service area.
Right, Cam, thanks for that. Right, I see there's a few hands up here. Anne, you're first. Your mic's on, Anne. There you go.
Thanks, Jennifer. You're on mute, that's for T-shirt. Just, Cam, you've just brought another question to me. So I'll ask that one first before I go into the other ones. The food that you talked about, the meals, did I read somewhere that we're going to charge them for the food, but we're not going to charge them for the delivery of it?
So in terms of the subsidy that's applied at
Aye.
the moment, so we don't, there is no, there's no charge for anybody, so that for delivery, etc., for us to get the meal to them. And the charge for people to receive a community meal, for the whole meal, etc., is £3, just over £3. So part of a proposal going forward is to look at, and it is heavily subsidised by the HSCP, and there's a bit of inequity in respect to that, because other people in the community who go in and buy their own food, prepare their own food, etc., go out and source their own food, don't have it subsidised. So, you know, kind of one neighbour getting a really heavily subsidised meal package and someone who doesn't. So it's just about making sure that we have equity, and we're looking at a fairness in terms of the charging policy as well.
Thank you. Thank you for that, Cam.
Thanks. I would quite like more information on that and how you're going to do it. And I just, it doesn't feel right to me, but I don't know enough about it. So if I could get more information, that would be good. The other thing was about for this. It's not for you, Karen. It's for somebody else. Maybe Jennifer will be able to help me with it. It's about the care homes. And we've got 3 care homes and we want to go down to 2, right? But really, how are we, you're wanting us to agree this, to look at it, but not to agree with care home. So we're agreeing that you're going to look at that and then come back to us again with the proposed stuff. Is that right? Is that my understanding of it?
Yeah,
so everything is...
Sorry, I can pick that up. Yeah, that's a proposal, is to allow us to go out and engage with our residents, their carers, their loved ones, our staff, to look at that option about, you know, the proposal to move from 3 to 2, and what would be, based on the outcome of that engagement process, what would be the most appropriate care home.
Okay. So, interesting to know how big each of the care homes. That's another thing I would like. And obviously you've mentioned everybody apart from trade unions, so you will be getting the trade unions involved at the very early stage of this. Staff.
Yeah, so we've already
staff.
Yeah, so we've already met with the trade unions. We have a whole programme based approach around sustainable futures, and we have both our health trade unions and our council trade unions are part of those programmes, and we had a separate session with our trade unions colleagues just to go through the proposals. So there will be, you know, involvement with trade unions throughout this process, because clearly staff are involved in the discussions as well. So we want to make sure that our staff have their trade union representation and that we are taking our trade unions through the journey with us. Okay, thanks. That's good. I'll look forward to hearing about what our colleagues in the trade unions think of it. I think
Our
that's
hope
all.
is that we take the staff with us, Karen, is it not? Because we need the staff, you know, so the hope, Anne, would be that the staff would come with us.
Absolutely.
But Jennifer, just for some of it, sometimes management are failing to engage at the very onset with the health side staff, and some colleagues within the council have came. So it's just about making sure that we have them from the very beginning and they follow the process of it.
I appreciate that, Anne.
I'm quite disappointed that we don't have any reps here today. Can I see them? But when it's such an important thing, and I know that Annie doesn't work a Friday or whatever, but that's all I've got just now. The rest I can just take to Christine if there's got any issues. Thanks.
Okay, thanks for that, Annie. I do appreciate it. Christine, do you want to come in just now? I know that.
Yeah, just in response to that, and so as you've said, we don't have any staff side reps today. Annie put her apologies in and was looking to see if anybody could sub, and that wasn't available. But what we had our SPF, so our partnership meeting yesterday, and certainly the message from staff side is they were never comfortable with any savings proposals, but absolutely comfortable with the level of engagement that we have had and partnership working. As Karen said, we've got a Sustainable Futures Programme board. Staff side are part of that board, as is council trade unions. So we are doing our very utmost to make sure that everybody is engaged and clear, as Karen says, to work together on these difficult decisions.
Thanks, Christine, and that's good. And it is difficult times, and we appreciate that, and we know that you're working hard to try and make it as, I don't know what the word would be, as easy as possible or as light as possible, because I know in a couple of months' time we're going to have other hard decisions, you know. So, yeah, thanks for that, Christine.
Thanks, Christine. Jacqueline, I see your hands up.
Thanks, Chair. Yeah, I just wanted to reflect a wee bit on the gravity of the situation we're facing today. 2017, as you know, I became IJB Chair, and I thought I was facing some difficult situations then, but it pales into comparison at what we're looking at now. And, you know, I think it's safe to say, as Francis has covered, that there's, you know, discomfort for all of us in this, you know, especially for the staff who've come in, you know, as a vocation, and they're committed to supporting people who are vulnerable and have disabilities. And now we're faced with making these decisions. So it's just to let people know that this isn't something that we're taking lightly. But unfortunately, we're forced into this position at the moment. And if we look at the context that we're in, we've just come out of a global pandemic. You know, whatever the politics you think of Brexit, it decimated our workforce. And I will get political when I say that we are facing a UK government who don't care about people with disabilities, that they have manufactured a cost of living crisis, and that poverty is a political choice that they've made and foisted upon us. And I feel quite strongly, and I feel quite emotional about the fact that I'm being forced into making decisions about vulnerable people that I wouldn't have had to otherwise. And finally, what I want to say was we have to balance our budget. We can't not balance our budget. If we don't do that, then it's even worse for the vulnerable people in Renfrewshire. And unfortunately, that is the gun that we have at our head today. So I just want to make sure that people understand that certainly I've worked in advocacy for 10 years and as a councillor for 6 years, supporting vulnerable people. And I'm not comfortable with the position we're in, but that's where we are, and the difficult choices have to be made. Thanks.
Appreciate that, Jacqueline, and I'll echo that. Fiona, you're next.
Thanks, Jennifer. Carers are still recovering from the impact of the COVID. Their mental health is still suffering, and their ability to continue to care is potentially affected. Carers have grave concerns for the future service reductions and savings in SDS, daycare and respite. I've been asked by the Carer Centre to ask what considerations have been given to carers in preparing this paper, given the amount of social care unpaid carers contribute to our local economy. It is very, very difficult times. My mantra is always partnership working. I think there's some really difficult conversations need to be had. There was also an email sent in from the Learning Disability Support Group to the IJB today, so they would like that answered. I'm not going to ask the questions that they've sent in due to the short time I have today, but if they could be answered, that'd be much appreciated.
I'll bring Frances in and she can talk about the engagement she's had so far, Frances, and address the email exchanges.
Absolutely. And I mean, I think I speak on behalf of the wider SMT that we completely recognise the invaluable contribution that unpaid carers make in Renfrewshire. And I appreciate the really challenging position that we're in today, but I think we do have a demonstrated track record in Renfrewshire of engaging really well with our carers, and I think a lot of the ways that we've done that doesn't happen everywhere else, and we have tried to, even during this quite difficult period, continue in that mode. And whilst it has been sort of broader conversations about sustainable futures, I have met with a number of groups, and along with Laura Howitt and other members of the SMT, we have gone along to meet with the LD Carers group I chair the Strategic Unpaid Carers Group, and Laura chairs the Learning Disability Planning Group, at which we have kept cited on the work of Sustainable Futures from an early point, and explained the scope of that as clearly as we could. I appreciate the concerns and recognise the concerns that the unpaid carers have made and the correspondence that they've sent through, and we will give every opportunity for them during this engagement process to feed in those views, and we will take account of them as part of the options proposals coming back, both in their viability but also about the how we would do them if we were taking to take account of unpaid carers' concerns. So that's I think Laura wants to come in the back of that, because I appreciate that a number of the views come from her area in learning disabilities. So if that's okay, Chair, I'll pass over to Laura to add to that.
Thank you, Frances. And again, I would just echo everything that Frances has said. Any change is impactful, and completely appreciate impact to families and people who care for people who are vulnerable and need a degree of support. And to that, the appreciation to our unpaid carers within Renfrewshire is huge. In relation to the options that have been put before IJB this morning relating to the learning disability services, I think I would just want to iterate and assure in looking at any of the options that are available to us currently, that those proposals are not presenting a service cut to people. At present, it's looking at different ways of doing things to be much more efficient with the resources that we have. So to provide some assurance in going forward into engagement sessions, should the IJB approve, we will be taking that forward in discussions to get people's views on how best to deliver on an option to bring back to the IJB. Again, as I say, if IJB approve us to go ahead with that today. Even change that doesn't result in any service reduction, completely appreciate that does have an impact on families and people that we support. So it's very, very sensitive going forward. And you asked earlier on, Chair, around decisions being made in relation to retention of building bases. And of course, people's views will be integral to that, but I appreciate that there will be a range of different views depending on people's current experience and current provision. But nevertheless, that will be very much part of an open discussion and transparent in terms of any decisions that may be arrived at should we go ahead with engagement. So I think just to assure, what we have tried to do is protect service for people, very vulnerable people. What's being proposed in the options currently, particularly around Mirren and Milldale, is to be more efficient and to try to do things a bit differently, and also bearing in mind that we have an outstanding action on the co-produced action plan for learning disability that challenges us to look at progressing more community flexible based options for people. So we've looked at this option as being part of an opportunity to do that. So thank you.
Thank you for that. Fiona, I hope that helps to reassure you somewhat.
Yes, that sounds super. Part of my job is lead practitioner for inclusion, Laura. So I'm responsible for setting up activities for adults with learning disabilities. So last year we had 23 people come through our doors. We now have 120 on a weekly basis. So we maybe have further chats about that, about different provisions that are potentially out there.
Absolutely, Fiona. Absolutely. Okay, where do we have? We have Ian McMillan. Ian.
Okay, thanks very much. Many of my comments will probably echo some of the things have already been said. And there are other opportunities for me to have go on the political side, but I will not bring politics or party politics in this morning. But I think today is a really dark day for the IJB here in Renfrewshire. the choices we're having to make here this morning are unpalatable as far as I'm concerned. But as Jacqueline Cameron said, we've been really pushed into a corner here with a gun against our head, and it's really, really difficult for us. I think using reserves absolutely breaks my heart. I liken it to get into your own bank account and taking your money out and just flinging it away. That's what it feels like. You know, we have got reserves there, reasonable amount of money, and they could be used for so many better things than to just close a budget gap. And, you know, councils have had, and now IJBs have heard, I've had this wee bonus about the pension. You know, not having to pay so much high contributions. And that, again, that really should be something you should be welcomed and should be used to further enhance our services, not just to close the gap. Like Anne, I'm a bit concerned about the community meals. Although I've tried to understand what's going on, I'm not entirely sure. I wasn't here in 2020 when there may have been a wee bit more kind of wider discussion on it. I would like to have seen practical examples of what that means to, you know, person A, person B, person C, and I would have liked to have seen that. Maybe that will come out in the future. Closing a nursing home, I know what that means, but I'm not entirely sure what this community meals actually means. I'm a bit concerned about when we're engaging with people. We're talking about, I know time's tight and I get that, but we're talking about speaking to people in December and January. December is the quickest month of the year because things kind of stop working mid-January. And I'm concerned, mid-December, I'm really concerned about the timing of the consultation. I don't know if I've got a lot of choice because these decisions have to be made for April or so, but I really have to emphasise we need to make sure we engage people. We need to make people understand or let people understand actually what's going on. I'm also concerned about the knock-on effect on unpaid carers. You know, some of these poor souls, you know, will be affected by these services, but also their families will be affected greatly with them, and that's really, really a concern for me. And I think Francis Burns probably summed it all up. This is only the beginning. You know, there might well be an awful lot worse to come. Now, I spoke to Jennifer yesterday. I hope she doesn't mind me saying that I phoned her. But I'm just finding all this very, very hard to deal with. And I wasn't going to put up any amendments or motions or anything like that. And I was prepared to accept what's been said because we're not really making any final decisions today. It's just really agreeing the direction of travel. But I went to my bed last night thinking about this. I got up this morning at 6 o'clock thinking about this. So I've muddled together an amendment, not to stop the process, so don't need to worry about that, any of the officers, and I do appreciate the work that's going on so far. But I think I would hope I could get a seconder, and I would hope I would get agreement. I'm not entirely sure to send this to who to. It's normally Mark Connican, but I'm not very sure if Mark's on the call this morning. Could maybe Elaine?
It'll be Nairn's filling in for Mark.
Yes, if you could send it to Elaine, please, Councillor McMillan.
Right, I've got it titled to Mark Connick and CC to Elaine, so I'll just press it now and it's away. So Elaine will get it at least anyway. As I say, the motion itself is basically recognising the situation that we're in. It's giving permission for the board to contact both the First Minister and the Minister for Health, just to say the situation that we're in, you know, just to let them know. In a few weeks' time, as I said earlier on, we're going to be talking about the Scottish budget, and for them to be mindful about some of the decisions that, you know, I could have made it general. I've been talking about IJBs in the whole of Scotland, but I've made it specific about the IJB here in Renfrewshire. I would hope it's not contentious and it's a genuine, heartfelt attempt to speak to the wider Scottish communities to say, look, this is what we're having to do here in Renfrewshire. And hopefully, I don't know if you've got it by now, but if you can have a wee look at it, as I say, I'm proposing that is to be part of the recommendations. And if I can get a seconder, that would be absolutely fantastic. If not, I think I've certainly, hopefully, made my point, and I think it probably sums up some of the feelings from other people as well, from what we've heard this morning. Right, thank you.
I've not received it, Ian. Do you want to read it out?
Sorry, I'm just sending the email just now, so it might just take a wee minute.
I'll read it out. I'll read it out anyway, the now, because it probably sounds a wee bit better when you read it out. To further recommend that the proposals in this report are brought to the attention of both the First Minister and the Health Secretary. The board requests that due consideration be given in the upcoming Scottish Government budget to the effect that the proposals to change services in order to produce a balanced budget will have in vulnerable people and their families who rely on the vital service provision that Renfrewshire IJB provides. I hope it makes sense.
From what you read out there, Ian, it does make sense. It's more or less what we done at the last meeting. Hang on a wee second. I see Jacqueline has got her hands up. Jacqueline.
I'm trying really hard to maintain being apolitical, and I promise you I'm not making a political point here. This has come from the officers. The Scottish budget is going to very much be dependent on the autumn statement from the Chancellor. And, you know, so I think if we're going to write to the Scottish Government, I think we write to the UK Government too, because it's, you know, it's a knock-on effect, no matter what people say. And I'll say, oh, I just blame Westminster, but that's a fact. And Alistair MacArthur will tell you that that's not coming from a political viewpoint. So we need to be careful here, because from what he has mentioned, that although in some terms it looks like we're getting a bit more, the capital side of things is getting cut by the same again. So we're in a, you know, Sarah will probably be able to tell us more about that than my kind of fumbling around trying to explain economics. But I just think that that's an important point to consider, Ian.
Can I come in, Jennifer? I would totally accept that. I did write that this morning at 6:15 in the morning, where we wasn't clear of mind. No, I'd be more than happy. I totally get where you're coming from, and I support that. Okay, Michelle, can I bring you in?
Yeah, thank you. Can I just say all my comments at once so it saves you time, Chair? Because I think just to address that one of the points I was going to come in and say was around the decision of the UK Government in the past week, their budget decisions, the knock-on effect of the decisions around employability and forcing people into work circumstances is going to have a knock-on and domino effect into our services. And this is what we see occurringly from any government, and that is UK and Scottish Government, where there are decisions that are made where there's not due course and process given to local government, our role, our IJBs, our professional individuals and our carers, where that communication has failed. Because one of the biggest failures of our societies at large is communication. That is always going to be the biggest failure, that as a society, when we are trying to look after our most vulnerable individuals, that we never do it right. And that I have been in the NHS for 18 years. And the one thing I can guarantee you is that change comes, and it changes, it changes, it changes. It's like a chameleon, and it's always around political flavour. So for me, I am supportive of the amendment that's been put up by Councillor McMillan. However, I'm also in agreement with the terms and expressions made by Councillor Cameron. I do think that it is explicit that we really, really need to ensure that those aspects are included in that proposal. I'm very, very supportive of that. But I think that we have to give good recognisance of our concerns, because at the end of the day, as ever, IJBs, local government, having to mitigate barbaric measures put in by national government is absolutely deplorable, and it's ridiculous that we are put into these circumstances. But once again, councillors will take the responsible decisions, and IJBs will take those responsible decisions to ensure that we best protect the most vulnerable in our communities, and will continue to do so. Thank you, Chair.
Thank you, Michelle. Thank you for that. Okay.
Chair, I wonder if I could just check then on on where we're at with the terms of this amendment. So as originally written, it read, to further recommend that the proposals in this report are brought to the attention of the First Minister and the Health Secretary. The board requests that due consideration be given in the upcoming Scottish Government budget to the effect that the proposals to change services in order to produce a balanced budget will have on vulnerable people and their families who rely on the vital service provision that Renfrewshire IJB provides. Are we adding Also, that these proposals be brought to the attention of the UK Government in reference to the recent autumn statement made by the Chancellor.
Yes, I would rather probably have that in the body of it, but yes. So do you want to amend it, Ian, or will we go with what James is?
Well, I think the wording is fine, but I agree with Jennifer that maybe should be in the main body of it. So, you know, to further recommend that the proposals on this are brought to the attention of you maybe put Prime Minister and Chancellor in there, and then both the First Minister and Health Secretary, just so that that's contained right in the middle of it. You with me?
Yep.
I'm sorry, I'm not quite sure I followed that. Could you run that by me again, Councillor?
Right. Sorry for giving you this worry here. To further recommend that the proposals in this report are brought to the attention of the Prime Minister and the Chancellor and both the First Minister. If you want to put UK Prime Minister and Chancellor, whatever.
Okay. The Prime Minister and the Chancellor of the Exchequer.
And both the First Minister and Health Secretary.
Okay.
Can I just check you've got a seconder, Councillor McMillan?
I'm asking.
I'll second it. I'll second
I'm happy to.
Oh, we're all rushing to second you here, Ian.
No.
Yeah.
Thank you very much.
So the amendment's proposed by Councillor McMillan, seconded by Councillor Adam. Is there anybody that wishes to make any counter proposal or a counter motion?
No.
Okay.
I see there's still a couple of hands up. Karen?
Thank you, Chair. I just wanted to come back into the discussion from Councillor McMillan around community meals. I suppose in terms of just a wee bit further explanation around it, the ask this morning of the IJB members really is just for the implementation of the eligibility criteria, and that eligibility criteria is applied to all services with the exception of our community meals and our community alarms within the HSCP, which was why the proposal was taken in January 2020. We simply paused it at that point because of COVID, but it absolutely doesn't mean at the moment that anything will change. We will just apply that same eligibility criteria that's applied to absolutely every other service within the HSCP to these two services, and we would utilise that eligibility criteria for not just new packages, but when we're reviewing current packages of support, we would utilise the eligibility criteria as agreed in January 2020. It's just that we hadn't progressed with that because of COVID. I don't know if that's any more helpful, but I certainly will be able to even to meet with yourself, Councillor McMillan, and to go through some examples of where where people have the community meals in place, if that's helpful.
Happy to meet with you, Karen, and it's examples I'm looking for. You know, that would bring it to life for me. Thanks.
Okay.
Right. Okay. Thanks for that, Alan. I see your hands up.
Thanks, Jennifer. I just thought I'd make a point in relation to the sort of support that we hope to offer the officers during this. There's a few of us, Fiona, obviously myself, and Stephen Cruikshank. We're non-voting members of this board, so there's a sense of what we bring is really, I suppose, influence. You know, and I would want to bring the influence and resource, obviously, the sector to this. And it's noted in the paper that that's the expectation, that as we progress, no matter how unpalatable all of this work feels at the moment, as we progress, there's a chance to maybe work in partnership to find some way forward. So I just wanted to make that point in terms of support to the officers that within the sector, I'm sure, because there's a growing relationship there, and it's always been good in Renfrewshire, but I do believe it's actually grown. So I think there's an opportunity there to support that. As I say, no matter how difficult, we would try to do that. So thanks, Chair.
Thanks, Alan. Thank you. Anne, see your hands up.
Thank you, Jennifer. Would it be possible, Karen, for you to send a copy of what the criteria is that you're going to implement as well?
Absolutely, and it's the HSCP's eligibility criteria. We apply it to every single service, so certainly we'll be able to send a copy of it to yourself.
That's great, because I don't actually know it, so it'd be good to know it. And it's a bit like Ian, I'm looking for examples of certain things, so it makes it live to me, and how it's done and how it would affect the individual. But yeah, I would be happy to have a Teams meeting with yourself and Ian, or a face-to-face, whatever suits. In the council chambers, I don't mind either, Ian.
Okay.
Right, bye.
Okay. Lisa Cameron, I see your hands up, Lisa.
It's just to reassure on the community meals perspective under the eligibility, everything goes through operational teams apart from community meals just now. So we've got a duty system, and within that duty system, anybody that makes a request for a service will come in and will be screened by a worker. We will look at somebody's ability to prepare their own meal, purchase their own meal.
Well, if there's no more questions or comments, can we go through the recommendations? So that's to note the update provided and the progress made in implementing.
I think we've lost Jennifer there.
She's frozen. She's frozen.
Who's the deputy? Need to stand in. She can't get back in.
Do you want me to read out the recommendations?
Yep, that'd be good, John. Thank you.
Okay. Note the updates provided on the progress made in implementing the Sustainable Futures programme, including the issues and challenges identified in Section 5. Don't see any hands up in opposition to that.
Can you just remind you about the motion, the amendment that was added onto it as well?
I'm back in the room, John. Thank you for that.
Okay. Yep.
So you went through the recommendations there, and the only thing to add is Ian and I's amendment then, is that right?
Agreed.
Agreed. Right. Well done. So that's, John's done that. Right. Don't know what happened to my internet there. I was blaming my daughter. She's on a sick day today, as you can maybe hear. So, right, okay.
Don't you blame your Wayne? That's what politicians do.
That's exactly what I'm doing. She's in there creating all sorts of havoc for me. Right. So we're in item 7. Have I missed one here?
6.
6. Right. Right. Item 6. Performance management benchmark and report.
Yeah, that's me again.
Right.
Okay, so this paper updates members on benchmarking analysis that we've done against national indicators, and it also highlights some of the local improvement work that we're doing to improve outcomes and performance. We used to bring benchmarking analysis to the IJB annually, but as a result of the pandemic, the last report you'll have received was in January 2020. As a result of the pandemic, the data in this report presents varying levels of information as the COVID-19 has affected the completeness that we've got and the trends that we can sort of identify from that, particularly around hospital activity such as like emergency admissions. So as a result of that, you will note that this paper more focuses on our current comparison with our family group of HSCPs, which I think many of you will be familiar with the use of family groups. Ours are Stirling, Clackmannanshire, Dumfries and Galloway, Falkirk, Fife, South Ayrshire, South Lanarkshire, Stirling and West Lothian. And we also provide a comparison against our local Greater Glasgow and Clyde HSCPs and the Scottish average. So the focus in this report, because of the pandemic, is on current comparisons rather than drawing any historical trends. So we've measured our performance against the national core indicators 11 to 19.
The reason why you've not got 1 to 9 is they come from the health and wellbeing, the health and care survey, which is only published every 2 years, and we won't get those results till spring 24, but we will share them with the IJB when they become available. And then we've also benchmarked our performance against the living health and wellbeing profile indicators. So we've provided the full analysis for these in the 4 appendices, each against the family group and then against the GGC HSCPs. So in the cover report, we really just provide some highlights. Firstly, by going through the national core indicators and then going through the health and wellbeing profiles. And for each of these, we just go through the same structure where I've highlighted where we were best in group or above average against the Scottish average or the family group and GGC averages. And then I've sort of collectively looked at where our areas of improvement and provided a bit more information on the areas of improvement about the actions that we are doing locally to address these. What I would just highlight to members is that it's probably the family group probably provides the best reflection of performance because they are chosen because they are HSCPs with similar types of population area type rather than across GGC. So I don't plan to go through all the results, but there's a few highlights that I would probably pull out. Where both the best family and GGC group for the number of days people aged over 75 spend in hospital when they're ready to be discharged, and that figure should align with the IJB are aware of our really strong performance in relation to delayed discharge. And we're also strong in relation to emergency admissions for adults, readmission to hospital for adults within 28 days of discharge, and the proportion of your last 6 months of your life spent at home or in a community setting. In terms of the health and wellbeing, we're best in family group for baby and child health weight indicators, and we're also better than the Scottish and family average in relation to probable suicides, drug-related admissions and emergency hospitalisation. So as I mentioned, I provide more detail on the indicators where we're looking to improve performance. So in the report, section 7 highlights the national core indicators that we would look to improve on, and some of them are like premature mortality or our fall rate, and we've outlined the work we're doing there. And similarly, section 10 of the report highlights the areas of improvement in relation to health and wellbeing profile. So some of the indicators we're looking to improve there: alcohol-related hospital admissions, life expectancy, and the population on prescribed drugs for depression, anxiety and psychosis. So I'm happy to, I realise I've just covered a number of the highlights, so happy to pick up any individual questions MD might have on the content. Thanks.
Yes, fine, Francis. Do we have any questions or comments on the report? Ian, you see your hands up.
Thanks. Sorry for disappearing there. My doorbell went twice there, so sorry about that.
Sort of mine, I missed
it. There is a lot going on here, and I must admit I found it quite a fascinating read, to be perfectly honest with you. But I suppose the one is the premature mortality rate. I think that's kind of stumbled in recent years, and you know, whether COVID's had a big, had a big effect on that, I'm not entirely sure. And no doubt there'll be more academic research done on that, but I suspect it has. But that's my worry, and you know, we obviously have a huge gap here in certain parts of Renfrewshire where you can expect to live maybe 10, 11 years longer than somebody that just lives 3 or 4 miles away from you, you know. So it's always been a big concern for us here in Renfrewshire how wide that gap is. So you know, I was certainly very interested to read that point, and I'm sure there'll be many reports coming in future months and years about how we can kind of close that particular gap. Thank you.
Okay, thank you, Ian. Any other questions or comments? I don't think so. We're fine to agree to note item 6 then. It's just, yep, it's for noting. That's fine. That takes us on to item 7, the workforce planning update for year 1 progress. Is that yourself?
That'll be myself, Jennifer.
David.
Thank you. So, yeah, this paper provides an update to the IJB on the progress that the partnership has made, working with our partners in NHS, GGC and the Council to deliver our workforce plan, which members will remember was agreed by the IJB in November last year. So overall, I think it sets out a positive position and shows the progress that we've made across the 48 actions which we had identified to start in year 1 of the plan. Of those, we've completed 9, while a significant proportion are also rated as green. So there's 28 actions where progress is on track, but we've noted that they will remain ongoing actions beyond the first year of this plan, so they wouldn't necessarily be completed within the last 12 months. There's also a smaller number of actions, 11 in total, which are shown as having started with either their completion delayed or others which have been paused for the time being. And the detail on the rationale for that is provided within the paper and the appendix as well. There are a number of examples of the actions that are categorised against each of their ag ratings within the paper, but I'll not go into those in any detail just now because I'm conscious of the time that we have this morning. But the paper also does set out the actions that we are planning to commence in year 2 of the workforce plan. In advance of this meeting, we undertook a review of those actions that we'd said would start in year 2 when we'd originally written the plan, and we've updated these where appropriate to ensure that they've reflected the changing circumstances for the HSCP and the IJB. An example of that is really where we had previous references to transformational change. We've now refined these to reflect the ongoing work around sustainable futures. And there are also actions that we've streamlined where we'd identified duplication, and we've taken those out to make sure that our recording and our resources are focused as effectively as we can do. The last point I would just like to flag is that similarly to the update that we provided in September on the strategic delivery plan, we've also noted in section 6 of the paper that with the wider financial context and the focus on sustainable futures that the HSCP has, there may be a knock-on impact on our ability to deliver all of the actions that we had set out within the plan when it had originally been developed. So we will bring further updates on this to the IJB and set out any changes to that position that may occur. But it's just to make sure that the IJB was aware of that. And should the IJB approve the paper today, we'll also submit an update to the Scottish Government on the progress made, which is in line with their requirement for us to provide annual updates.
Okay, thanks for that, David. Do we have any questions or comments? No, so we can note the progress made and approve year 2 set of plan and approve the submission of the appendices. Agreed? Agreed. Takes us on to item 8, the refresh of the strategy for mental health services in Greater Glasgow and Clyde. Is that yourself, Laura?
Myself, Chair, thank you. There is quite a comprehensive appendix to the paper that was submitted for consideration today. So it is quite unwieldy and hope you've had managed to have a look through it. The paper itself refers to the refresh of the mental health strategy within Greater Glasgow and Clyde, and it relates to the adult mental health national strategy also. So members were updated on the GGC strategy at the June IJB in 2022, specifically regarding progress updates relating to the Action 15 of the National Mental Health Strategy and the development of a Renfrewshire mental health and wellbeing and primary care model. The June 2022 report also referenced the work of the GGC Mental Health Programme Board, which includes the board's preparation to review all activity against objectives set within the first 5 years of the strategy and to produce a strategy refresh for 22-27. So the work on that's now complete, and as I've said, the details are outlined within this paper and attached as Appendix 1, which is the NHS GGC 5-year mental health strategy refresh, and it's been amended just to refer to the dates. So the dates have changed to 2023-28. members for noting that this strategy refresh has gone to all 6 constituent HSCPs within the GGC board area, and Glasgow, as lead for mental health, have already taken the update strategy refresh to their IJB and has been approved. So the other HSCPs within the board wide are now seeking approval from members similarly. So just to highlight a couple of areas within the report, section 3 of the report outlines the background to the strategy refresh, and it highlights the existing mental health strategy, proposes a system of stepped and matched care, which allows for progression through different levels of care, with people entering at the right level of intensity of treatment at the right time. And the aims of the strategy is just to remind our integration across services to provide a condition-based care approach and shifting the balance of care further into the community. Section 4 of the report highlights that the strategy refresh widens the scope of the existing strategy and establishes a joint approach to or strengthens the relationship with strategies covering the whole complex of mental health services in the GGC board-wide area. And it describes progress against the recommendations in the existing strategy in other areas. And again, just as a reminder, the vision for the strategy includes community focus on delivering prevention and early intervention, expanding the development of recovery peer support workers, improving the effectiveness of community services, developing unscheduled care pathways and supporting faster discharge from hospital. And for members noting, there'll be further updates on the work as it develops, with areas requiring further integration joint board approval submitted to future meetings. Also for noting in section 5 of the report, members will be aware from previous reporting of Renfrewshire's positive performance in this area relating to Action 15, with a range of proactive posts and developments supported through this of the National Mental Health Strategy. And I remember bringing a report to the IJB previously, where the variety of posts and developments were received well by members. So just for noting that confirmation has not yet been received from the Scottish Government relating to some of Renfrewshire's expected recurring budget allocation against their ongoing and Action 15 commitments, and that this has impacted on our ability to continue to fund some temporary posts. We are expecting, however, to receive correspondence from the Scottish Government by the end of 2023, and it's hoped then that we'll be able to recruit to these posts on a permanent basis. And finally, members are updated in section 6 of the report with regards to mental health and wellbeing in primary care. Again, IJB was updated in the June 2022 paper about plans for the implementation of our HSCP action plan to further develop mental health and wellbeing in primary care services. However, the Scottish Government advised in late 2022 that this programme had been paused and associated funding has also been paused. And at this point, we don't have any further update on whether that will restart again or whether funding will be made available. So our action plan, therefore, is also being paused. I think just to provide assurance to IJB members that we continue within Renfrewshire mental health and primary care services to work together to build on and improve our current positive interface arrangements, and we will hope to increase those opportunities for further development through the GGC strategy refresh. So happy to take any questions.
Okay, thanks for that, Laura. Do we have any questions? No. I've got a second, I think. Everybody's in agreement here. Okay, then can we agree to note the progress made, note the updates relating to Action 15, and approve the refresh of the strategy for the mental health services in Greater Glasgow and Clyde 23-28. Okay, agreed. All righty, that takes us on to item 9, Renfrewshire HSCP Winter Plan.
Yeah, that would be myself, Chair, to cover this one. So this paper follows on from an update which we provided to the IJB through the Chief Officer's paper back in September. And that update itself outlined ongoing activity relating to winter planning and wider business continuity planning that the HSCP was working on.
Yeah.
Winter planning itself across NHS GGC started really early this year. It started in May. And the paper sets out the work that's been done over the intervening period to develop and refine Renfrewshire's plan for the coming months. The plan itself, which has been developed, is provided in Appendix 1, and it follows the same structure that we've used in previous years for consistency. It also reflects the priorities for the health and care system, which were set out in the Scottish Government's Winter Preparedness Plan, which was published at the end of October. The plan itself is really a summary of the more detailed organisational and service-specific plans which we've developed, and of which there's 21 in total. And those plans are really in place to mitigate a number of the ongoing risks that we see potentially occurring this winter. Again, those risks are really broadly similar to those that we identified last year, and they reflect the ongoing challenges facing health and social care. They're described further themselves in section 4 of the paper, but they include areas such as the impact of high demand for services in areas such as care at home and within mental health inpatient beds, the wider financial climate that we've discussed, and also its impact on services in our communities. Again, as we've discussed, ongoing supply chain challenges such as those in prescribing, and the continued risk that we face of high levels of COVID and flu infections this winter, which could put pressure on our staff base and also on acute services within hospitals. We will continue to monitor the implementation of the plan, and will refine and reflect our response over the coming months as we need to address any emerging pressures. And we'll also continue to work with NHS GGC and Renfrewshire Council to build on the existing comms that we have in place and ensure that we have regular updates and aligned messaging throughout the winter for our staff, for our services, and for our communities as well. Very happy to take any questions from the IJB.
Thanks for that, David. Do we have any questions? Jacqueline.
Yeah, I'm sorry if this is somewhere in the body of this. I have read the report, but I'm having trouble at the moment with retaining information. But anyway, that's another story. It was just, I think last year, if you remember, we talked about fuel poverty and about people being cold in their homes. You know, there was deaths last year because of people being cold in their homes, and people hospitalised, you know, with pneumonia and various things. And I know that the care at home staff were primed to keep an eye out for that. And I'm just assuming it'll be the same again. But I just wanted to check that that's the case and that we've considered that.
Yeah, absolutely. Karen, do you want to come in on that one first?
Yeah, absolutely, Councillor Cameron. That's something that care at home staff have all been primed to look out for, and they know that there's an escalation process in place should that happen, should they come across, and they actually are primed to have conversations with people just to make sure that they are heating their house properly, heating themselves properly, and that they're not stressed or anxious over fuel poverty.
Thanks for that, Karen. Thank you.
Okay, Alan, I see your hands up.
Thanks, Chair. It was just really sort of building on Councillor Cameron's point. Obviously, there's a range of activities taking place that might be helpful for older people to be aware of, or all people to be aware of, actually, in relation to fuel poverty. Obviously, with the Winter Connections programme funded by the local authority, but obviously delivered with the support of the local third sector. So I think, whilst obviously this is very, you know, looking at some of the real schematic in relation to hospitals, etc., but there's obviously that maybe wider aspect of health delivery during the winter that's maybe worthwhile profiling within the staffing complement, just so they're aware of it. Thank you.
Thanks, Alan. John.
Karen, what if they can't heat their house properly?
So we would be able to make sure that they could, John, and we would also refer them on to other areas where and other supports. Lisa will have the detail. I see Lisa's just put her hand up there. Lisa will have the detail in terms of the supports that are available to people to ensure that they're able to afford and not stress over the heating. Because I am aware that, you know, for our older population, there is huge levels of anxiety as we go into winter about the affordability of heating their homes. But if I bring Lisa in, she will be able to give practical examples of the support that's available.
Thank you, Karen.
Yeah,
I suppose
you know,
just to...
you know that there's a generation that just doesn't heat their homes. They just say, well, can't afford it, just don't do it, and that's when you get deaths and hospitalisation and deaths.
Yeah, and I think that's the difficulty, and that's some of the stuff when our care at home team identify people and they have that conversation. If they feel that there's more support required, they refer again to our duty system. Renfrewshire Council has a duty system 5 days a week where it's manned by social workers, occupational therapists and ASCs. We will go out on urgent visits, we'll speak with people, we'll talk them through the finances, the importance of heating their house and so forth. And for those who can't afford, we get things like advice works and we'll look at energy grants, we'll look at support grants. Absolutely, there's some people who just still won't heat their house, and it's looking at making sure we've got warm blankets, we've got things that will heat their hands, heat their feet, and try and encourage that way for those who can afford it, and for those who can't, we absolutely seek any support that we can for the people. But there is a mechanism and a support mechanism in and around through the social work service.
That's very assuring. As a parish minister, I encountered it often myself, but that's very assuring, Jennifer, to know that. Yeah, thank you.
Thank you. Ian, go on in.
It's really sad that we're having this conversation in 2023. It really, really is. You know, it's something I associate with the 1900s or even earlier than that. And I think there was something that on the radio the other day that some women down south hadn't had their heating on for almost 2 years. Now, I just can't fathom living in a cold house. It'd be absolutely horrific. And I think Renfrewshire Council has done a really, really good job in its winter connections. But of course, you can't reach everybody. It's just impossible. So it's kind of reassuring to know that we've got measures in place. But right now there'll be somebody sitting in their house, and I'm looking out the window now, and it's clear blue skies, and I'm sure outside it's pretty cold. There'll be somebody sitting in here now in their house now saying, "I've got this all weekend, just sitting in the house, absolutely frozen," and it's really, really tragic, as I say, in 2023 that we're even having this discussion. Thanks.
Okay. No more questions, comments? Okay. So can we approve the Renfrewshire HSCP winter draft plan and note the plan that aligns with the NHS GGC board and note the implementation of the winter plans? That's the recommendations. So just all agreement there. Okay. Thank you for that. That takes us to John Trainor's Chief Social Work report. Are you here, John? Yes, there he is.
Convener, thanks very much, and thanks members for the opportunity to make a very brief statement, because I'm conscious that today's been a very long meeting and some very, very challenging issues to be discussed. And I think it's interesting to have watched a number of IJBs recently having very fractious meetings, and this meeting's actually been very collegiate while still being challenging. And as the Chief Social Work Officer, I appreciate that support from you as members to Christine and her team, who have got incredibly challenging times ahead as they exist across other areas. Convener, the report of the Chief Social Work Officer is a requirement in law. So once a year, I'm required to report on the distinct role of the Chief Social Work Officer, not in my operational role as Head of Childcare and Criminal Justice, but as the Chief Social Work Officer. And for the partnership, that role remains about the role of a professional advisor to Christine and her senior leadership team, to yourselves as members of the board, to look at the distinct functions of social work and social care. I think we've heard today within the IJB the range of challenges that are facing the IJB and service delivery across Renfrewshire. And those challenges are in fact replicated across Scotland. And I think a common theme around the Chief Social Work Officers this year will be those significant pressures. The report's fairly detailed or a detailed summary of the activities. It doesn't cover everything. The pages 211 to 213 I think will be particularly interesting to yourselves, because those highlight the activities of adult social work and adult social care services within Renfrewshire. I think there is a good standard across the service. You'll see in the report that we do acknowledge there are some pressures within those services. There are pressures across social work in general about recruitment and retention of staff. That's a national issue. There are pressures in relation to recruitment of social care staff. Again, that's a national issue. And I think that earlier this week I had some interesting discussions, convener, with the Minister for Social Care and Health around some proposals about how we begin to look at addressing some of those immediate challenges, but do better around workforce planning. And interestingly, the workforce plan that the Health and Social Care Partnership have devised, I think, is a particularly strong model, and recommended it to the Minister to be looked at. I think that just finally, I mean, the issue about inspections, one convener, where we are faced with challenges, but the report notes some positive inspections within adult services, and whilst I'm concentrating on adult services, it's not unique because the IJB provides support, the Health and Social Care Partnership provides support to adults who are involved with justice social work, whether that be through, for example, drug treatment and testing orders, or support for alcohol and drug recovery, or support through mental health. So there's a connection between adult social care and social work and the justice social work services, and equally amongst children. So the report hopefully gives that range of coverage. I think just in closing, convener, what I'd like to say is that it is a challenging time, but the staff within the adult social work and social care services provided by Renfrewshire Health and Social Care Partnership are incredibly committed. They're committed to working to support those who require access to services. They're also committed to working in partnership with the voluntary and third sector. And I think Alan, being on the board here, lets you hear and see some of that in action, as does Fiona from the Carer Centre when you see that. So a very challenging time. I think the report captures that. It sets out some difficult times ahead, but I think if we work together, we will be able to navigate and mitigate any negative impact, or as much negative impact as we can. Thanks, Chair, and I'm happy to take questions.
Thank you, John. I appreciate that. You've got very reassuring way with you. Same as Stuart Sutton. Pair of you are very reassuring when you come in. So I appreciate that, John. And do we have any questions or comments? No, well, I'll just be agree and note your report then, John. And I think it's for noting, but there is one to agree on there that just to come back to find another meeting. Well, I guess amount of paperwork. Yep. So just for noting, and agree that the next annual report for Chief Social Work will be presented in autumn. Okay, John. So thanks for your contribution, and it does help to reassure us with your professional opinion that the senior management team, how hard they're working and how it does align with strategic plan. So that is, it's reassuring to me, John. Thank you for that. Right. I think I might have lost my agenda. No, I've got it. Right. Next items, item 11, climate change duties. Who's talking on this one?
That's myself.
To have anyone. So is
It's
that Francis?
Yeah. Okay, thanks. So this picks up on our statutory requirement for the IJB to report each year on its compliance with climate change duties to the Scottish Government. So we've got to submit that by the end of this month. So helpfully, the Scottish Government does recognise that the setup and structure of the IJBs differs from other public bodies. So we've got quite specific guidance on our expectations, because unlike our partner organisations, NHSGGC and the council, who would report on admissions and emissions and things like that, we don't have to provide the same level of detail. But the Scottish Government are more interested, I guess, in how we work with the partner organisations and how we take into account climate change in our decision making and the way we plan our services. So whilst we don't directly employ staff, and we don't have our own buildings and things like that, we are fully committed to and actively participate in tackling the climate emergency. And we work really closely with our two partner organisations and also the wider community planning partners. Whilst most of our focus is in delivering the partner organisations plans, in section 4 I have just given a flavour of some of the activities that the HSCP specifically has been involved in. So it really is just looking for the IJB to approve the content. I appreciate it's very challenging to read in print. It would need to be seen online, but we don't have control over that. It's a prescribed template that we get from the government. Just asking really for approval of this report so that we can submit it to the government. Thank you.
Okay, do we all approve? Oh, Ian's got his hands up. Ian, come on in.
As always, I've got a question. I had to laugh there, Francis, when you said it's very hard to read. It's not very hard to read. It's impossible to read. Because when I was reading the hard copies, I was like, you're having a laugh. Because honestly, you couldn't read a word of it. Thankfully, when you go online, you can make it a bit bigger, and it's not quite so bad. But I don't know how you get round about that, because we don't want to use up too much paper, given the what the report's all about. But at the same time, if somebody has only got the hard copy, it's just a complete and utter waste of time, because you can't read anything. I had a question about reporting emissions, but you've probably answered that, and we don't have to report emissions, and it's just really working with, as you say, with our partner organisations. But other than that, I'm quite glad to see the report. It's something that certainly my members in my group take very seriously, and I know the council take very, very seriously the climate change emergency that we have. So I'm glad to see it on today's agenda. Thank you.
Thanks, Ian. I think there's quite a lot of things that the Health and Social Care Partnership do that, as a consequence of like healthy living, getting people to walk, trying to reduce vapes, which now, a lot of the disposable vapes. So there's almost a positive unintended consequence that we actually support a lot of the council and the NHS's agendas through the work that we're doing without asking more of our staff. So yeah, thanks. Okay then, if there's no other further questions or comments, can we just agree to approve the content of the report? Agreed? Agreed. And then we go on to item 12, which is the IJB Audit, Risk and Scrutiny. It's a verbal update. I think that'll be from yourselves, Mags.
Thanks, Jennifer. Yes, just a quick update in terms of our meeting last week. We've actually had quite a lot of activity in terms of the committee's actions over the last wee while, between some training work and the committee. The purpose of the verbal update is just to make sure that there's a regular feedback loop to the IJB itself, because the Audit, Risk and Scrutiny Committee is the only standing committee of the IJB. So it's just to give everyone that opportunity to ask a question if there's anything, and just give you a bit of a heads up as to what we're covering. So very briefly, what we did do is review our terms of reference, just to make sure that as a committee we're doing everything that's required of us, and that there's no overlap or confusion or duplication. So it's quite a healthy exercise to go through. Our meeting was only last week, so the agreed changes that we've made will come to the IJB at a later point for approval, so everyone will have visibility of that as well. We've done some self-assessment work on making sure that we are doing everything that we should do. A few actions have come out of that, and one of the key ones being we'll provide an annual written report to the IJB of all the work that goes through that committee. So I think just firming up some of the actions we're doing, but overall I think it's pretty positive process. We had our update on risk, and also very positively an inspection report on Hunter Hill Care Home, which came out as good. So I'll leave it at that, but any questions, happy to pick up today or at any point in the future. Thanks, Jennifer.
Thanks for that, Mags. Do we have any questions? Okay then, that's great. Thank you for that, Mags. And then that just leaves us item 13 is the date of the next meeting, and it'll be January the 26th, 2024. So that's us. So listen, let me just thank you all for your time today. I know these meetings are incredibly difficult, and I know you've all been living and breathing this for long and weary, so I just want to thank you for your time and your consideration, and I'm glad we can all work together, including you, Ian. I'm glad that, so thank you all, and I look forward to seeing you again. Okay, take care.
Thanks, Jennifer.
Bye.
Thanks, Chair.
Thanks, Jennifer. Well done, Sherry.